welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Ban on smoking in public housing reduced cardiovascular hospitalizations study. A new study in nicotine and tobacco research found that the 2018 US ban on smoking in public housing led to a decrease in hospitalizations for cardiovascular problems. Researchers examined the impact of the smoke-free policy on hospitalization outcomes for heart attacks and strokes among adults over 50 by comparing hospitalization trends among New York City public housing residents to a matched comparison population in New York City. The study included only adults aged over 50 because heart disease risk increases substantially as adults enter their 50s. Study highlights role of cognitive behavioral therapy in lowering chronic back pain. A new study has found that 8 weeks of either mindfulness or cognitive behavioral therapy (CBT) training led to meaningful improvements among adults with chronic low back pain that's currently treated with opioids and had not responded to prior treatments. These behavioral therapies help improve physical function and quality of life and reduce pain and opioid dose in a randomized clinical trial. The benefits persisted for up to 12 months. The findings were published in JAMA Network Open. The team enrolled 770 adults to participate in a randomized clinical trial conducted in 3 sites: Madison, Wisconsin, Boston, Massachusetts, and Salt Lake City, Utah. Participants on average experienced moderate to severe pain, functional limitations, compromised quality of life, and numerous prior treatments for their chronic low back pain and were treated with daily opioid medications for at least 3 months. UCL researchers developed AI tool to track effectiveness of multiple sclerosis treatment. A recent study highlights new artificial intelligence tool that can help interpret and assess how well treatments are working for patients with multiple sclerosis, MS. The findings are published in Nature Communications. The tool called MindLight can extract key information from brain imaging acquired during the care of patients, such as measuring damaged areas of the brain and highlighting subtle changes such as brain shrinkage and plaques. MindLight is a deep learning model developed by UCL researchers to assess MRI images of the brain and identify damage and changes caused by MS. In developing MindLight, scientists use an initial dataset of 4247 brain MRI scans from 2934 MS patients across 592 MRI scanners. During this process, MindLight trains itself to identify markers of the disease. This new study was carried to validate MindLight against 3 separate databases of 14,952 images from 1,001 patients. Researchers tested the effectiveness of MindLight on over 14,000 images from more than 1,000 patients with MS. MindLight was able to successfully use AI to detect how different treatments affected disease progression in clinical trials and routine care using images that could not previously be analyzed and routine MRI scan images. The process took just 5 to 10 seconds per image. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.